How common is self-catheterization after Botox for OAB? If you're considering Botox injections for overactive bladder, you might wonder how often you'll need to do self-catheterization afterward. The good news is that most patients do not requiring it. Self-catheterization is a method some use to empty the bladder if it cannot do so effectively on its own. After Botox treatment, some people may experience difficulty emptying their bladder, leading to urinary retention or high residual urine volumes. Research shows that about 18% of patients already use self-catheterization before their Botox procedure and continued afterward. But the majority, around 80%, did not need to start or continue self-catheterization after treatment. This indicates that for most people, Botox does not cause significant bladder emptying problems. In fact, many patients can urinate normally after the procedure, with only a small percentage experiencing temporary retention issues. When is self-catheterization recommended? Usually, if the residual urine volume after urination exceeds 200 milliliters and the person has trouble voiding, doctors might suggest self-catheterization. However, some studies suggest that prescribing catheterization based solely on residual volume without symptoms may not be necessary. It's important to remember that each person's response to Botox varies, and treatment plans should be tailored accordingly. Patients who need to perform self-catheterization are often taught how to do it safely before their procedure. The frequency depends on how much urine remains in the bladder. Some may need to catheterize once a day, while others might do it several times a day. It's generally advised not to catheterize more than every 3 to 4 hours or more than 6 times in a day. As the effects of Botox wear off over several months, the need for self-catheterization usually decreases. The main side effects of Botox for overactive bladder include urinary tract infections and difficulty emptying the bladder temporarily. Some patients experience a brief inability to fully urinate, which can be managed with self-catheterization. Most patients can urinate normally after treatment, but a small number may need to use catheters temporarily. From a bladder health perspective, it's crucial to monitor for urinary retention after Botox. Incomplete emptying can increase the risk of infections and other bladder issues. Proper evaluation before and after treatment helps identify those who might need self-catheterization. For those who do, learning how to do it correctly is key to maintaining bladder health and preventing complications. In summary, self-catheterization after Botox for overactive bladder is not common for most patients. It becomes an important tool only if urinary retention occurs. With proper patient selection, education, and follow-up, Botox can be a safe and effective treatment option that minimizes the need for self-catheterization. Always consult your healthcare provider for personalized advice and management plans tailored to your specific needs.